This hernia surgery may have put her over the edge. My new grandbaby is going to be coming and we're gonna give her the farm tour. Oh, no biting. Good morning. So we had a pretty good storm during the night. I think the storm woke me up at like 4:30 this morning. It was pretty nasty, but as far as I can tell, there's not really any damage. I talked to my dad this morning and he said he got 2 inches over at his place just this morning. It's supposed to get like really hot and steamy today over the next like 2 hours as soon as these clouds clear out of here and the sun comes out. And that's kind of always what it's like after it rains here. The second the sun comes out, the whole place just turns into a sauna. Okay, before I get too far into chores, there's just a few things I have to take care of. I've got a kid, she's kind of on the runty side. She has joint ill, so like her joints in her front legs are swollen and kind of fluid filled. So I was out of my antibiotic of choice the other day when I treated her the first time. So I gave her a different one and it definitely kept it at bay and went down a little bit, but it's not healing up the way I'd like it to. So I'm going to give her now a second dose. And then that doe right there, that kitted, gosh, it's been almost 2 weeks now. She's still straining a bit. So I'm just taking her temperature daily. She had a full 7 days of polyflex after she kitted. And she doesn't stink at all. She's not really showing signs of metritis other than the straining. So the vet said as long as she doesn't have a fever, like let's let her work through it. Nothing has really changed. She's slowly improving, but she's not getting worse. So we're just kind of monitoring that for now and making sure she's doing okay. And then we have to treat that doe laying that had the hernia. So she was on my keeper list from the time she was born. So I've been trying to like tame her down. I was finally doing a pretty good job of taming her down because the reality is if they're up on pasture, I need to be able to walk up to them and catch them or at least get close enough to use my crook to get them. And so that is part of, that's part of my criteria right now. For choosing does. If we were in a complete confinement situation, that wouldn't matter. But when they're out on 9 acres of woods, I need to be able to walk up to them should I need to treat them for something or assist with a kidding or whatever. This hernia surgery may have put her over the edge because she is like psychotic now. She knows I'm trying to catch her to give her polyflex, so she's not having it. So I don't think I'll be able to get on film me trying to catch her. I have to sneak up on her. So we'll see. Here she is. So she's actually looking really good. And you can see she's got her little tummy tuck, right? She's like, I know you're after me. So she's still at 102.6, which is totally fine. So we're gonna let her go. And then this is that doe. Stop. Get off. So you can see her knee joints are swollen and squishy. They do look better than the other day. So joint ill. Infections like this start they can get in through the umbilical cord, so that's why we dip their navels right away. Now a bacteria can still get in there, and a lot of times it doesn't show up until like months later. I knew it could happen like 2 months later, but I didn't think she's like 4 months now, so I really didn't think that it could happen anymore. And the vet said, yeah, it could have been lingering for that long and just finally settled in the joints now. And that would make sense why she is like very petite compared to the rest of them. If she's been working through something this long, that just wasn't evident to me. So this group looks so small now that we hauled all those other ones into the sale barn. So now we're left with like just the ones that were a little bit smaller, and then kind of the runties and the replacement does, which are always smaller than the bucklings. So all of a sudden they all look, there's like a big divide. I'm just gonna let these guys out here. Come on guys, this way. No, keep going. Peanut, turn around. Come on, be a leader. Come on. This is where I'd like you to go. Please step lively. Up. Farther this way. Okay. There's new pasture down that way. We all look lost. For the love. I have to always show them. This is your pasture right now. It looks like we finally found, so the fence came across here and they're finding now this long stuff back there. Well done. Oh gosh, got a few stragglers back here. You don't see it? Come on. The two old ladies. What? You're too lazy? That gate's getting closed, so you better figure it out. Okay, so those are out. Now we can close this up and we'll get these guys out to just give them a little more room. Hi. There's nothing out here exciting. Okay, it is getting really disgusting and steamy and I still have rubber knee boots on, so I'm going in. I got the cattle moved up. The thistles are getting really tall in some portions that I bale grazed in like 2 years ago. I'm actually gonna give them a round bale while they're in there also. So right now I'm trying to like slow them down to give that next pasture to get just a little bit farther ahead before I go ahead and put them in that pasture because I want as much forage growth as possible. So I'm gonna kind of park them on this other one for a little bit longer than I normally would, and that round bale will supplement that extra forage that they need. So I brought their waters up. They all had like an inch of mud in the bottom, and there's like big scrapes on the inside. So I don't know if the calves were going swimming or I don't know what was happening, but I'm gonna get those cleaned up, and then I filled the water tank here, and then I'm gonna give water. morning. It is a very exciting day today on the farm because my new grandbaby is going to be coming and we're gonna give her the farm tour. We're gonna expose her to some dust and some germs. We wanna get her started early. I'm just really excited to see her. I want to take a minute to talk about this doe. She stopped straining. She was constantly squatting. So I called my vet again and I was like, I don't know what to do about her. And she's like, well, I don't, at this point, I don't know what it could be. So kind of a last ditch effort, she said, why don't you go ahead and give her some Lutelis? She might have like an abscess that could be pushing on her bladder, and that's why she's always feeling like she has to go potty. She said, unfortunately, if it's like somewhere outside the uterus, there's probably nothing we can do, and it'll be a culling decision at some point. However, she said if it's something inside her uterus, we might be able to get it expelled out. So I did that yesterday morning and didn't really have high hope. I come out this morning and it looked like she had a little bit of white discharge, but when I got closer, this was what she had. So there must have been a little bit of like a little chunk of retained placenta in there. The Lutelis is doing its job. It's expelling it out. So I'm just gonna let it do its thing. But I'm super happy that this is working, and she seems much more comfortable. Like she was standing normal when I came in, and that's what kind of made me look at her like, oh, is something going on? Like, you look comfortable. I sent a picture to my vet and I'll give you any updates that she said, but I think we're on the right track with her and I'm super happy.